Hello, and thank you for tuning in. This is Captain McKnight with Army Medical Recruiting, based out of sunny Charleston, South Carolina. Here today to speak to you about the HPSP program that the Army offers our medical and dental school students. Now, this particular presentation is going to be specifically geared toward the medical side of the house. So what exactly is the HPSP program? It's a scholarship that we offer our medical school students that pays 100% of tuition and fees. And by 100%, I mean everything. It even covers the step 1 and 2 tests that you have to take while you're in med school. We offer a 4-year version for our undergraduate students who are matriculating into medical school. We also offer a 3-year and a 2-year version for those students currently enrolled in medical school. It comes with a $20,000 sign-on bonus, and you get a monthly stipend of $2,600 a month. Now, you get this monthly stipend 10 and a half months out of the year. The other 45 days, you do active duty summer training. And this is where you do some of your introductory courses into the Army, and you get active duty pay, and that totals about 5,400. And that's a nice way to have a summer job, basically, if you don't have anything else going on. Now, this training will not be scheduled if it interferes in any way with your medical school. And I think MUSC is pretty good. But if their schedule changes, you can just push it to the right where you finish medical school, and this is where you'll get that training in. We offer 72 residency programs, so anything that you are going to specialize in, you can specialize in the same profession within the Army. So if you're going to be an internal medicine doctor, you can be an internal medicine doctor for the Army. Now, everybody's thinking this is almost too good to be true. I understand. So everybody wants to know what's the catch. The catch is you owe 4 years of service to the Army, and I don't mean as a machine gunner or a grenade thrower or a cook or anything like that. Whatever you specialize in your residency training, that's what you're going to be for the Army. So if you're an internal medicine doctor, that's what you'll be for the Army. Okay, so requirements. You need to be a U.S. citizen, graduate before the age of 42 for med school, and that number 42 can be moved around if you served in the military in some capacity before. You need to physically qualify. The biggest thing there, medical history and height and weight, and that's based off of age, sex, and height. Score 500 on the MCAT and be accepted to a medical school. So that's geared for our 4 years applicants. If you've already are currently in medical school, the last two don't necessarily apply to you because you're already in med school. So the application process, you work with the AMED recruiter like myself, and the entire process can take anywhere between 1 and 3 months on average. It's such a lengthy process that you wouldn't think would take this long. This is why I encourage applicants to apply early, the moment you realize that you want to do, even if you plan on applying next year, and I'll tell you why. So we're going to gather up your source documents, pack everything up. I'm going to do a background check on you, got to do a physical. And from those two, we'll know if you'll need a waiver, and waivers can take 1 to 2 months to complete. So this is another reason why I say start this process early, because this is the biggest hangup getting through that physical exam. You're going to have 3 letters of recommendation. You're going to do a statement of motivation, basically just saying why you want to be a doctor. We gather all that up, package it up nicely, and submit that packet to the board. They make a decision. You get selected. You take your oath of office. Then you go on to finish med school. So the residency process is the same match process that the civilian sector uses, meaning I can't guarantee you a one particular field. You have to compete and match into a specialty the exact same way that you would have to do. Just like I can't guarantee you the same way that the dean at your college can't guarantee that you're going to be an anesthesiologist. But I will say that we do have a 90+% match rate. Just because the pool is so much smaller, you're only competing against the other HPSP applicants for whatever slot that are open. And so for any particular year, that could be 250 people versus in the civilian sector, 4 or 5,000, however many graduates are coming out of medical school each year. So you get your full pay during residency versus when you're being a civilian resident, you may get 30, 40,000 as your salary. Whereas when you're doing your residency with the Army, you get your full captain pay, which is 70, 80, 85,000, depending on where you're located at. And then your time of service starts after residency is complete. So during residency, you're getting full pay and you have no debt versus having 200 to $300,000 worth of debt and you're getting 30 and 40,000 and then expected to live off that while paying down that mountain of debt. So this is the biggest topic that always comes up when someone learns of the scholarship. They don't know if they can pass basic training, and I'm just here to tell you that you can pass it, and this is the number one reason why. because there is no basic training. Commissioned officers don't go through the traditional basic training that you know of. We do have a basic officer leaders course, but that is in downtown San Antonio, and it's a classroom setting, air conditioner, no one's yelling at you, nothing like that. So there is a beginning training, but it's not the basic training that you know of. So you don't even have to go through that. Basically, your basic training is medical school. That's what we want you to focus on and complete. You complete that, and that is your basic training. So here's my contact information. I can be reached via cell, email. You can even send me a message on LinkedIn. You can scan this QR code and it'll put my contact information directly in your phone so you can reach me. If you have any questions, don't hesitate to reach out to me. Once again, HPSP scholarship pays your tuition, 20,000 sign-on bonus, give you a monthly stipend, all for 4 years of service. 4 years of working, which is what you're going to do anyway. As there's no reason to graduate with mountains of student loan debt if you don't have to. This is one option that you can use to actually get your school paid for. I look forward to hearing from you, and for those of you that are ready, welcome to the Army.